America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. My producers in studio, Mr. Darren Wilhite, behind the microphones, behind the cameras, Dave Thiessen. All these shows are videotaped and put up on our YouTube channel, 15 podcast channels and 238 affiliates across the country. A shout out today to KLIN in Lincoln, Nebraska, 1400 AM and 99.3 FM. We're getting a lot of calls and a lot of interest from folks in Nebraska. So we wanted to say thank you to the folks at KLIN in Lincoln, Nebraska for keeping us on the air. We're happy to be there. If you are chronologically challenged and you are looking for Medicare coverage, you can call the lovely Carolee Steele at Benefits by Design, RPS Benefits by Design. The number there is 877-385-2224. So if you are turning 65, you're trying to figure out Medicare, she can certainly help you. If you are an employer looking for group health insurance, Maria Allers can do the same thing at Benefits by Design. It's RPS Benefits by Design, 877-385-2224. By the way, a lot of those short-term policies that are out there are going away at the end of the year. If you are one of those folks and you're looking for some alternatives, RPS Benefits by Design has got some plans you may not know about. You might want to give them a call, 877-385-2224. All right, joining me in studio today, Melvin Swafford and Ryan Lilly. Melvin Swafford is the VP of LEAPCare, and Ryan Lilly is the Regional Director. And we're here to talk about this program today that interacts with human resource folks throughout the country in companies large and small. And the theme of this show, and the reason why I'm doing this, is because we're going to talk about a lot of things that employers can't deal with, don't know how to deal with, but unfortunately get brought to work. And the theme of the show today is bring your whole self to work. So welcome, Melvin. Welcome, Ryan. Glad to have you both here today.
Thank you very much.
Thanks, Gary. A little bit about Melvin. Melvin Swafford is Vice President of Business Development for LEAPCare. Melvin has served as a care coach, Regional Director, Vice President of Operations for 12 years. His company has led him to engage in a vast number of businesses to hear the pain points and determine how to help them if a professional caregiver might be the best benefit the company provides. Melvin currently lives in Knoxville, Tennessee, and he's been married for 30 years. Ryan Lilly is a Regional Director of LEAPCare, presiding over Kansas, Illinois, and Northwest Indiana. Ryan had a fruitful career in management in national retailers and business development in banking and software industries. Ryan trains, equips, and develops care coaches to provide exceptional care in the workplace. He and his wife, Sherry, have his son, Gabe, and they live in Stillwell, Kansas. Ryan's also in my Bible study group, and that's how I got to know him. So let's talk a little bit about what LEAPCare is, give a definition here, and then we're going to talk about the problems that employers and HR directors face every day that they don't have the answers for. These are challenges that come to the workplace every day, and we're going to talk about that. So let's just start with a bit of a definition about LEAPCare. Melvin?
LEAPCare, in its simplest form, is to proactively care for employees in the workplace. So we go into businesses and we provide a benefit that is voluntary, permission-based, and confidential. We do an orientation to introduce the benefit, then we begin making rounds. The rounds, we do 30-second to 3-minute conversations just to get to know what the employees like, what they don't like, who they are, how they do their job, what they enjoy, their whole person. And so we've been doing this now for 28 years. We're in all lower 48 states and in Canada, and it is served right at 1 million employees.
And that's really quite remarkable. And we're going to delve into that today. But let's kind of define the issue. Why would you be interested as an employer or an HR director in talking to these folks? Okay. And I have some experience here with a personal situation that Ryan was able to help me with. And that kind of led me to where we are today to bring this in studio today. So you've got an employee. These are things you may not know about. You may see a problem with your employee not performing properly on the job or having issues, whatever the case may be. But let's talk about some of these things, Melvin. Financial stress, marital issues, children's issues, elder care, stress, just a few of the major things that affect people's performance at work okay, but they really don't have any place to go. And if you think an EAP program will do that, an employee assistance program, I hate to tell you this because for 26 years I sold EAP programs, participation levels about 7%. People are not necessarily comfortable doing that, and they're not typically going to do it. So while an EAP program is a good intention, I'm not telling you not to have it. I'm telling you that it's not going to be nearly as effective as what these folks are doing with their care coaches at LEAPCare. So talk a little bit about what happens when these kinds of things go on. I don't care whether you're in a manufacturing situation or somebody sitting in a cubicle behind a desk working a computer, whatever the case may be. How does that affect people in terms of what they're able to do at work?
Well, I remember several years ago when I was a care coach, there was a truck driver who was driving a load of chicken from North Carolina down to Florida. And he said, "Hey, I'm really distracted today. My grandmother's having surgery in Pittsburgh. Could you help me?" I said, "I could do that only with your permission. I can dispatch a care coach in Pittsburgh." And I happened to call Mike Stout, who was on his way to that same hospital that day. And he asked permission if he could be there with with the grandmother. And she gave him permission. And he said, "I will be here during recovery." So he stayed there for 2 hours waiting. And again, everything we do is confidential. So when she came into recovery, he said, "I would really like to call your grandson who's driving right now to Florida, but I can only do that with permission because I can't break your confidentiality." She gave him permission, and he called this son. Now, he was a distracted driver. He was
clearly
very
loaded chickens.
So the next week I'm walking the terminal, and he was about 6'5". He picks me up off the ground and hugs me, and with a tear in his eye, he said, "Thank you for taking care of my grandma." Now, know this: I didn't give him permission to bear hug me that day, but at the same time, we don't know how a distracted driver might have every time the phone rings as he's driving down the interstate pulling 80,000 pounds, what damage that could have done. But those same things are happening in cubicles every day. People are coming to work with family issues, as you said. So last year we did 5,388,000 30-second to 3-minute conversations with employees. And from that, 500,000, 73,071 raised their hand and said, help me in those moments. And 110,082 of them were marriage or relationship related. I think back toward COVID with parents having to do virtual education and so many things that were happening inside the homes. So much, even domestic violence went up. And people would reach out and they'd say, "I need help now. Help me now." And we were ready to engage them. So many stories.
Yeah, and that's the whole purpose of what we're doing today. These are things that are under the surface. You, as an employer, HR director, whatever the case may be, you're not going to know that. Maybe there'll be an outburst. Maybe they'll say something to you in passing, whatever the case may be. But typically, that's not something somebody's comfortable bringing into your office and, "Hey, I'm having a real problem with my wife. I need to talk to you." That's probably not going to happen, right? Yeah, right. No, that's probably not going to happen. I've been married for 39 years, and I can assure you, if there was a marital problem in my life, I would not have gone in and sat down with my employer and said, "Hey, I need to talk to you about this," because that's just not the place. It's not the time, the place, and it's not gonna help you solve the problem typically. And most people are embarrassed to even talk about those kind of things. So they don't have you call this a pressure relief valve. Before we go to break here, talk a little bit about what that is.
Well, when we are engaging, let's say a sales teams, there is just a natural pressure. People are bringing to work every day. Owners want one of their values, many values, is to be teamwork. But how am I a good teamwork when I'm already emotionally maxed out? There's enough emotion in my emotional tank just with my immediate family to send me over the edge. Much less my extended family, much less what's going on in the world around us, all the things that bombard us, and then we're going to work emotionally exhausted, emotionally drained. And then I'm supposed to listen to my other employee, the person who is working with me, and hear all of their struggles and their crises. On average, we see right at 10 50% of employees approaching every week, a new group having a new crisis. We believe you're either in a crisis today, you're coming out of a crisis, or you're about to go into a crisis. And so we're able to engage them in a relationship, a proactive relationship, to go to them. We know what they like, what they don't like, who they are.
That's important, and I think that gives you some idea of why we're doing this and what we're going to talk about today. If you want to learn more, the website is leapcare.org, leapcare.org. If you want to call Melvin, maybe you want to learn more about what these folks do, 423-715-0693, 423-715-0693. That's his cell phone. He's willing to have a conversation with you if you want to give him a call. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. Stay right there. We'll be right back.
The Golden Rule. Treat others as you want to be treated. I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make, serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800, 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. You know, we're posted on 15 podcast platforms. We're on Spotify, we're on SoundCloud, we're on Odyssey, we're on iHeart. We're on 15 different podcast platforms across the country, and our YouTube channel, America's Healthcare Advocate. So, my purpose in telling you that, you're hearing this on the radio. Maybe you want to tell your partner, maybe you want to tell your spouse, maybe you run the business husband and wife like my wife and I did in our business, Benefits by Design, years ago. Instead of trying to explain all this, have them go up and watch the video, watch the YouTube video, or listen to the podcast. Then they'll have an understanding of what you're hearing and why that might make a difference to them. Once again, in studio with me, Melvin Swafford and Ryan Lilly. They are here from LEAPCare. The website is leapcare.org, leapcare.org. They are care coaches. This is what they do. They go into businesses, they meet with the businesses. You heard Melvin describe. They go in, they talk to each employee. Maybe it's 30 seconds, maybe it's 3 minutes. Maybe the employee doesn't want to talk to them. They don't have to do that. But they find that the majority of people do want to have someplace and somebody they can go to, that pressure relief valve that you, the employer, have to deal with the issues secondhand that they're bringing to work because they don't have anybody to talk to about this. So that's what we're talking about today and how that works. And so I'm going to use, Ryan, you as an example here. You were a sales leader for a very large company here in town. Okay, and I remember at our Saturday morning Bible study groups, we have what's called a breakout session after we do our Bible study. And then we talk about personal issues. And boy, you were talking about that quota most weeks. Okay,
yeah, that is correct.
If you were going to make it, if you weren't going to make it. And It was a lot of pressure on you.
Indeed.
And on top of that, you've got a son that has major disabilities, and you combine those two things together. I mean, from your perspective, and you walked away from that job to become a care coach and do this. By the way, I might add, he did that at a significant loss of income because he really believed in this program. But talk about what that means. What was that like for you, and how difficult is it for somebody, especially in that kind of a high pressure position where you've got a quota you've got to hit? Okay, maybe you're a truck driver and you've got so many miles you've got to drive, or maybe you're in an outbound call center and you've got so many calls you've got to make. I mean, talk about that situation.
Right. It's like the pressure is never ending, right? It just continually needs to build.
Hey, you made your quota this month. Here's a new one for next month. It's up 10%.
Exactly.
Yeah.
Exactly. And then you bring, your home to work, and, your family or your relatives or friends that have, spoken to you that week. And it's it's this mounting pressure that is in you that is like just waiting to pop off, right? And then how do you deal with that? What if people don't have somebody to go to? Thankfully for me, I had people in my life that I can go to and blow off some of that steam. The nice thing is when businesses invite us into their doors and the walls of their business is that, the folks that don't have anyone, or maybe you don't want to go to your mom or dad to stress them out about what you're dealing with, or your spouse or your kids. You don't want to dump on them because you want to make sure that they're healthy and they're doing well as a human being too. And this was one of those programs where I think you can have somebody that's confidential. It's permission based. I don't have to talk to them, and they are not forcing themselves on me. Each time they come around, they're just simply asking, how are you doing really? And that gives you an opportunity to say, I've got my son at home and he's dealing with X, or, my wife's dealing with this. And it gives you an opportunity to release some of that pressure and to allow you to focus then on your work after that brief 3-minute conversation. And so for me, the reason why I left that job, I did well. I was meeting my quota.
I remember you went to Ireland on a trip that they paid for. So you must have been doing pretty well.
On a club trip, yes, sir. And so, even with that, though, the pressure never went away. It was constant. And you might get a brief, breather over the weekend after a week of hitting your quota. But then, like you said, that reset button hits again and everything starts over. And so, again, I think as I started to investigate LEAPCare, I realized, wow, what an amazing opportunity to go and serve others that I understand what they're going through. And just so you know, when we hire care coaches, we're looking for folks that have anywhere from like 5 to 7 years of real world experience. And so they understand what it means to sit in a cubicle and make dials, or drive down the highway with 80,000 pounds of freight, or to make those quotas. But then also too, they're able to, they've got experience caring well for others in their background too. So we take that really seriously, and certainly has been something in my life that has been a significant blessing and a significant positive pressure release valve I mentioned before. So,
and it works. So, Melvin, here's an interesting statistic. This comes out of the notes you gave me before the show. Turnover, retention efforts, 75% in the trucking industry, 75% of the truckers move from job to job. The nurses, 40%, another high. Convenience store, this is a really good one, 125%, okay? It's very interesting when you talk about how this works. It affects, there's a cost to this. It's a hidden cost, but it's a cost. I remember I did a self-insurance program for a company that had a family that owned 5 nursing homes. And when I went to sit down with him to put a brand new insurance program together, I said, let me guess, one of your biggest problems is turnover. And I'm going to guess it's probably somewhere around 60 or 70%. And the woman who was the matriarch of the family, who had started all of this, looked at me and started laughing. We were in a boardroom, and it was really kind of interesting. She said, Mr. Hall, our turnover rate's 125%. I about fell out of my chair. I'm like, how do you stay in business? The dollars they were spending to retrain and start all over again were going right out the door because they were going to lose these people over a certain period of time. So talk about how you take these problems Ryan just talked about. I don't care if you're the truck driver or whoever you're working in the cubicle, maybe you're in a call center, maybe you're an IT guy, whatever the case may be. That gets transferred into work, and then it doesn't get solved. So what do people do?
We have white papers from grocery stores to law firms to engineering firms to trucking companies to poultry companies. We have white papers on so many companies that have said the cost. They've looked at the cost of their training, how much it costs to train, and then to rehire, retrain. What is the mental health cost, which they have mental health calculators that they see those things. Even car dealerships. With people fighting over sales, there's a cost in losing sales because of conflict in the workplace. And so many people would stand up around the nation and say, we are saving money because of what you do and how you're engaging proactively, and people are able to approach you with some of these struggles. So yes.
So in other words, what happens here is instead of taking this out and saying, well, I'm just going to go change jobs. This is not the place for me to be. There's too much stress here. I can't deal with this. And I'm going to go start all over again. And guess what's going to happen? The problem is not going to go away. You're not solving the problem. You're just taking it to another employer and going to cause the same problem to happen all over again. And some of these professions, he mentioned lawyers. I got a daughter that's a lawyer. That's a high stress job. Okay. Nurses, we all know the turnover in the nursing community is huge right now, especially after COVID. So that's the point in how this program works. We're going to come back after the break, and I'm going to actually walk you through what they do, how they do it, how they engage, and some of the results that they've seen. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. We've got more right after this break. Stay tuned. By the way, if you're interested, reach out to them, LEAPCare.org. They've got a great website. All the information is up there, LEAPCare.org. You want to call Melvin? Call him, 423-715-0693, 423-715-0693. Stay tuned. We'll be right back after the break. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. I'm going to remind you once again, we are on 15 podcast platforms. It is posted on YouTube. I think we got about 270,000 views up on YouTube now, if I remember correctly. Maybe more than that. I don't think, Dave, you haven't checked it in a while. So, but nonetheless, there are a lot of people who pay attention to the show up on YouTube. This is one of those episodes I think that's going to get a lot of attention because a lot of employers, HR directors, business owners, you're dealing with these issues every day. These folks solve those problems, and they do it in a very unique way, and create real value, and your retention helps retention in your business. And that's one of the reasons why we are talking about this. So let's just, Ryan, I'm the employer. You're going to come in and see me. I want to know what you're going to do. Talk to me.
Yeah, so typically the first step is us getting engaged with our development folks. You've decided to invite us in the doors to your business. Typically what would happen is I would reach out to you as a regional director, and we would have a conversation. I would understand, why are you bringing us in? Help me understand some of the issues you're having. And then, a year from now, what would you like to see? Is there a number that you would like to see decrease? Help me understand the dynamics of your culture. And then from there, what we do is we design an orientation around what that business owner is seeing and experiencing. And so we would have an orientation with the businesses sometimes because you have machines you have to keep on. We'll do that in small segments. We might get everybody together at once, just so everybody understands what LEAPCare can do, cannot do. And then really our main mode of operation is three things. Is we're permission-based, which means the employees control that conversation. We're not going to force ourselves on them. It's voluntary, which means, just like in benefits, you can opt out of a benefit, right? So you can opt out of this benefit by just simply telling us, I'm good. We still want to learn your name, right? So if a crisis does come, we're able to, know who you are, where you work, and put a face with a name when you do reach out to us. And then it's very confidential. And what that means is we're not reporting back to the business owner, I'm going
to stop you right there.
Sure.
That's critical. Okay. So if somebody comes to you and says, maybe I've got an addiction problem. Okay, I'm an alcoholic. Or I'm using dope, or maybe I'm addicted to pornography and it's starting to erode my marriage, or whatever the problem may be. They do not have to worry that you're going to go back and say anything to employer. It's 100% guaranteed that's not going to happen.
Outside if they're going to harm themselves or harm someone else. Now, if there is someone driving a forklift and they're intoxicated,
well, yeah, you might want to say something about that just in case.
I need to help. I need to help that employee, and I need to make sure all the other employees are safe. But outside of that, it's not our responsibility to be moles inside of the corporation.
Right. Okay,
we don't do that.
No. So go on, Ryan. You get through this process now. Now I say, yep. Ryan, I want you guys in here. We're gonna bring your program into play. Now, what do you do with the employees? How does this start?
Yeah, so that orientation is an introduction also to their care coaches. Okay. They're alongside me as I explain how the program works to the employees, and then that allows them to, meet that individual, shake their hand, say hello, for them to give their business cards, even at that orientation to say, hey, Even today, starting today, if you need something, you want to talk to me, reach out. I'm available to you 24/7, 365 days a year. And we really take that seriously. So if a person calls that telephone number on the Care Coach's card, that Care Coach actually has 10 minutes to respond. And we have a system in place where if that individual doesn't, let's say they're on a plane or, they're in the midst of another situation where they just can't break free for 10 minutes, that phone call then rolls to me. And if I don't get it in 10 minutes, it rolls to my regional vice president. So we have a system in place to make sure that you're getting care immediately when you need it.
So it's 24/7, and I'll tell you, I had an interaction with this group. I mentioned at the beginning of the show, my brother was in the process. He was in hospice and he was dying, okay, and I wanted to find a chaplain, and they found a chaplain for me. And we had a bit of a process with my brother and going through that, but they were there. I remember Saturday and a Sunday when I called and got help. I think this is key. They're not saying, hey, if you have a problem between 9 and 5, we can help you, okay, like an EAP program maybe. Okay, what they're saying is 24/7. They've got somebody on that line that can be of help to you if you have a problem. Okay, and if that person wants to reach out and engage or just talk to somebody, sometimes just talking to somebody makes a difference, does it not?
Absolutely.
Okay, so
absolutely. There's all kinds of needs. My first caregiving opportunity was in a poultry
He told me this story off air. He worked in a turkey processing factory. So tell the story. This is a pretty good one.
Just a great opportunity to care for individuals, but there are needs that I feel a little humbled here because there are needs in some industries that I as a citizen, I'm totally unaware of.
Yeah.
And because of different backgrounds. But here I was in this poultry processing plant, and there was a mother who needed housing and needed to take documentation to the Section 8 housing group, but they were closed. The office closed at 4 o'clock, but she didn't get off till 5 o'clock. And each week,
sounds like a simple problem, right?
She would try to get there to take the paperwork, but couldn't stand in line, couldn't get there because their office would be closed. And she just simply said to me, I don't know what to do. I don't know what to do. I said, I'll go for you. And so I took the paperwork, I stood in line, and I got that to the correct individuals and explained to them, this is what's going on. She's standing on her feet right now. She's working so diligently to provide food and resources for her family, but she can't be here. And so they took the paperwork and was able to help this family in that time of need. So what a joy. What a joy.
Yeah, it is. And I assume, Ryan, that's one of the motivations that had you leave the major corporation you're with, who was kind enough to send you to Ireland on vacation, to take this job where they're probably not going to send you to Ireland on vacation.
Yeah, that's definitely the case. No, it really comes down to, there are people in need, and we provide a tangible resource for them to get care in whatever facet they might need care for.
And I don't think you can emphasize enough when you look at some of these numbers in turnover and what people are dealing with, how significant this is. And it's literally under the radar. Am I right or wrong?
Well, in most businesses, it's right in their face saying, we've got to do something with retention today. I had a chief medical officer. He said, Melvin, do you know how much it costs for me to replace one surgeon in my city?
Oh, I can't even begin to guess that number.
He said, with moving them, with signing bonus, all these, he said $1 million. He said, if you can just keep this surgeon for just a small period of time extra, and that's what, if your employee stayed 6 more months, what would that do to your cost in your businesses? I have engineers or
high pressure business. I've got friends that are engineers. That is very intense work. A tremendous amount of concentration. They can't afford to be distracted.
Absolutely. But you have these apprentices coming up, and with our society today, when they were playing travel ball or in travel dance or in all these different venues, they didn't have a job. Well, when they went to college, mama didn't want them to have a job. They didn't have a job during college. They went to their master's program. They didn't have a job at that time. The first time an engineer, some of these engineers are having a job, is the first day in this engineering company. Here they are, all of a sudden 60 to 80 hours a week, having to get the workload done. They've never worked with a team. They've never punched a clock. They've never answered to a supervisor. And right before they left their engineering school, they get married. They get married, and they're messing up at home. They're messing up at work. And if they could just have a care coach, someone to come alongside them, maybe someone who's more seasoned, who could help them have answers just to guide them through true, authentic care. That's what we do.
And that makes a tremendous difference. So a little bit about some of the success stories before I go to break here. Just give us an example of something.
Success stories would be individuals. I had an employee who, this actually happened in Knoxville, Tennessee. It was an employee who was working up in Virginia. He was traveling down. He was at work, just started his job there, and his mother and father were in a car accident, and he received a call, said, "You need to get here now." So he got in the car and he started to leave, and he got to Knoxville, and before he got there, he received phone calls just nonstop, just saying, "Are you okay?" Making sure that he was focused. Got to the hospital. And his mother had already passed away.
Oh my.
Now his father has been flown to Nashville, Tennessee, and they said, if you want to see him, you need to get there now. And so he left, and again received phone calls. By the way, he was greeted by a care coach in the hospital when he arrived. He got to Nashville. His father passed away, but he was greeted by another care coach in Nashville. And but when he got back to work, he said, "I'd only been an employee here for 6 weeks. But there was not a moment from Virginia to Knoxville to Nashville that I was ever alone. Either one of my managers or a care coach was on the phone with me. When I walked into the hospital, there was a care coach. When I got in the car, I received a phone call from another care coach. When I got to the hospital, there was a care coach. They helped me in every aspect, even in finding people to officiate a funeral."
What a difference that makes right there. That is a classic example of why we're doing this show and what we're talking about. That's the difference. How do you think that man feels about where he works now based on what happened to him that employer provided him? We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. We'll be right back. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. The website, americashealthcareadvocate.com. Send me an email if you've got a question. I'm happy to answer it. If you need help with something, I often get emails and calls from people that are in need of help. If you need help with health insurance or health-related issue or anything I can help you with, please feel free to send me an email. I would be more than happy to chat with you and help you in any way that I can. In studio with me, Melvin Swafford and Ryan Lilly. They are here from LEAPCare. We are talking about what goes on in the workplace that is out of the purview of the employer. But people don't leave that stuff at home. They bring it right into the workplace. They deal with it every day. Okay. And it's affecting your employees. It's affecting your productivity. It's affecting your business. And it's right there. And I'm sure if you're an employer, you know that. When I had my company Benefits by Design, I knew a lot of the personal problems my employees had. And a lot of times those are very difficult issues to deal with. So having someone like these folks, like LEAPCare, available can make a tremendous difference, not only in how your employees feel about you as an employer, like, hey, you know what? He really does give a damn. He brought these people in here to help us, okay? In addition to the fact that it's going to be a very important process because it's going to lower the turnover rate in your company, and it's going to add to your retention and the way people feel about working in your company. That's why we're doing this today, is to educate and inform. So let's talk about that a little bit. When you're in with the employer evaluating all of this and going through the situation, talk a little bit about that and how that goes forward.
Well, that's exactly what we're hoping to do, is anywhere in the United States of America, in the lower 48, that you would allow us an opportunity to sit down face to face. So we have vice presidents of field development that will come to you. And if it needs to be a Zoom, we'll do a Zoom. But we'd rather sit down. We want to know how you operate. what your pain points are, what your needs are, and to see if a professional caregiver would be the solution.
Appropriate.
That's what we would do. And again, when it comes to pricing, which a lot of people will be thinking about price, it's just going to depend. How many employees, how many locations, how many languages you need, what are your needs? It can be vast amongst employees.
So let's go back to the poultry facility. In a poultry facility, let's just talk about Nebraska, for example. There's a lot of meat processing in Nebraska, out in western Kansas. Those employees are probably 80% Hispanic. How do you deal with that?
So right now, 10% of our care coaches are bilingual.
Okay.
But again, bilingual can mean many languages as well. But the Latin American culture is very valued in what we do. So we're ready to engage that culture with care coaches for sure. When I was at the poultry company, there were 250 French-speaking or Creole-speaking Haitians. I've been with the company now 12 years, but back in that day, there was a major earthquake in Haiti.
Correct.
So the Haitians were given work visas to work, but where are they going to work? So they brought them to the poultry processing plants. Now, what was really interesting during that time was just that was before direct deposit.
Right.
And many of these employees, they would be victimized on the weekend because they would be stuffing their money in their mattresses.
Yeah.
And they would come to work literally on Monday, bloodied and saying, "I need help. I don't have money for food." And so I would care for them and connect with other resources in the community to get them the care that they needed.
Yeah, see, that's the kind of thing. So we just talked about a surgeon, and it cost the HR director in that hospital $1 million if he moved a surgeon from one hospital over to his hospital. Now we're talking about people in a poultry facility. There's a big difference, right? It's pretty obvious, you think, maybe, all right? But they've all got issues, okay? It's not like this doesn't happen in white-collar jobs. It happens in white-collar jobs. Ryan, you were in a white-collar job, okay? Mm-hmm. I'm sure you saw it in your workplace and people you worked with, right?
Indeed.
Yeah, and so you see it in white-collar jobs, you see it. So it doesn't matter where these people, folks, wherever they are dealing with these issues in terms of stress, marital issues, problems with your kids at home. Where do I get a resource if I've got a child that's completely under control? I don't know what to do. And you're able to help them deal with that.
Nationwide, we're able to deal with that, Carrie. One of the greatest benefits of LEAPCare is that we are not just one person for your company, but over 400 networked together professional full-time care coaches that can be dispatched for anyone in your influence. So we care for the employee plus anyone in their influence, and a conservative number would be 3 individuals for every 1 employee. So if you need me to be dispatched, I'll give you an actual story. I received a phone call from an owner. He said, Melvin, I'm about to get on a plane. It's Father's Day. My brother was rock climbing with his 17-year-old and 15-year-old son, and he fell. He's a military veteran, and he fell. And he's lifeless, and he's at the hospital right now. And so we're getting on a plane, but it's going to take us 4 hours to get there. Could you help us? And I said, absolutely, with your permission. And I called a care coach in San Diego. He was 20 minutes away. He drove down. When he entered into the hospital, the 2 boys, the 17-year-old and 15-year-old, was white as this sheet of paper. They were in shock. And the mother was just talking nonstop because of the shock. Right. And he was in a halo and just in ICU. And it was just a difficult time. He stayed there those 4 hours until the family arrived. Then he turned into a servant role. How might I serve the family? Then he left and checked on them. Because he's full-time, he checked on them every day. Every day.
Do you see? This is exactly what I'm talking about. These are things that as an employer you can't deal with. Now, take that story and reverse that situation, and let's say that employee had to go there and they're not on their job, and you don't know what something's happened, but you can't offer resources to help them. So this is why I think this message is important. This is why we're doing the show today. This is why I wanted to get this out there. This is why we're going to put it up on the YouTube channel. We're going to put it up on the podcast channels as well, all 15 of them, and obviously we're airing this show across the country for any of you and all of you. I talk about this a lot. When I deal with something and I find that it works, that's what causes me to bring these people into the show. It was Ryan Lilly who found someone in Indiana to come in and help my brother in a very difficult time and help my sister and I who were there taking care of him. I reached out to them and they were there. In fact, there were 2 different guys that came. So it can make a huge difference, and that's why we did the show today. If you want help, the website is leapcare.org, leapcare.org. You want to call Melvin, 423-715-0693, 423-715-0693. Thank you both for doing this today. I think it's going to make a difference for a lot of folks. And now I leave you this thought from Dr. Martin Luther King. Americans must learn to live together as brothers and sisters, or we will surely perish together as fools. I think we've got some recent examples of that, and maybe that's something we need to think about in this country. Thanks for listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Goodbye, America.